This is the third and final module, which will provide a brief overview of some of the important aspects of maintaining compliance with the laws and rules. Most of this information is contained in Chapter 108 of the Rules and Regulations if you wish to read for more detail. The portions covered here are maintaining your license or certification, professional conduct. Many cases heard by the board for misconduct are from rule violations from this section. Professional responsibility, fair dealing, consumer information, patient abandonment, minimum standard of care, records, keeping it clean, and nitrous oxide. We have all worked hard to maintain a license or certification to practice in the field of dentistry and certainly want to maintain this credential. In order to do so, there is an annual renewal that must be mailed or sent electronically to the board before the due date. Each practitioner has an established fee to pay. These are listed in the Rules Chapter 102. In the process of sending fees for license renewal, each license or certification holder must attest to current CPR in compliance with all CE requirements. The exceptions to this rule are for DLTs who are not required to take CPR. 12 hours of continuing ed are required for the dentist, hygienist, and lab tech. The content must be scientific and technical areas that will specifically assist in the care of the dental client. In other words, courses taken to improve the management of your practice do not qualify. 4 of these hours can be in some type of self-study. Examples can be journals, continuing educations, or online self-studies that require a quiz to test comprehension. A maximum of 24 hours of classroom continuing education can be carried forward for 3 years. Other requirements for licensure include current CPR, an annual OSHA update, and a jurisprudence review. The jurisprudence requirement was included in the rules in January 2005, with the first 3-year period to be extended to January 2008. Each dental professional will need to update this requirement with 3 hours of continuing ed, which can be a self-study every 3 years. The benefit of retiring your license is that you will pay no annual renewal fees. However, you also need to know the procedure to reinstate your license should circumstances dictate. The State Board of Dental Examiners may reinstate a retired dental or dental hygiene license to active status provided the license holder submits a written request for reinstatement, pays the appropriate fees due to the time the request is made, and meets the following criteria. A licensee holder currently practicing in another state will show verification of licensure in 12 hours of continuing ed. A licensed dentist shall conduct his or her practice on the highest plane of honesty, integrity, and fair dealing. Professional responsibility also includes no false advertising practices, such as claiming superiority. Only a licensed pharmacy can sell prescription drugs. The laws and rules pertaining to pharmacies are contained in the Occupation Codes chapters 551 through 569. A dentist has earned the privilege to write a prescription and dispense samples. The problem arises when anyone in the office sells prescription drugs. The minimum requirement for fair dealing requires the dentist present a treatment plan and reasonable options in plain language to increase patients' understanding. This plan should include a timeline for proposed treatment, terms and conditions for payment, future services when anticipated. Further fair dealing dictates that a dentist does not overtreat or overdiagnose, does not flagrantly overcharge, and cannot hire an auxiliary to provide services that he or she cannot personally perform. This is in Rule 108.2. Patient abandonment is the next topic for this rules chapter. It states a dentist without reasonable cause shall not abandon a dental patient. Dentists cannot discontinue treatment once it has begun without providing written notification 30 days prior to discontinuation. This notice should be sent by certified mail with a return receipt requested. The notice must include description of the patient's current dental health status, present and future needs, consequences of no treatment. The dentist must provide reasonable emergency care for 30 days following this notification. A dentist must submit a written report to the State Board of Dental Examiners if one of the following occurs: the death of a dental patient which has occurred as a consequence of receipt of dental services. This report must be filed within 72 hours of the death or such time as a dentist becomes aware or reasonably should have become aware of the death. Number 2, the hospitalization of a dental patient as possible consequences of receiving dental services must be reported within 30 days of the hospitalization or such time as the dentist becomes aware of or reasonably should have become aware of this hospitalization. For purposes of this section, hospitalization shall be defined as an examination at a hospital or emergency medical facility that results in inpatient admission for this purpose or treatment and/or monitoring. The minimum standard of care is detailed in Rule 108.7. The minimum standards require the dentist provide pain management in the form of enteral or parenteral sedation. These standards increase significantly. We will continue with a minimal chart documentation on the next slide. The dental record is extremely important documentation that will be discussed a bit later in this module. As a minimum standard, the following must be documented in the patient's record: patient's name, date, and reason for visit, vital signs, minimum blood pressure, pulse, heart rate for the patients that are 12 years or older, additional entries for invasive procedures and/or anesthesia. If not recorded, an explanation of why these vital signs were not obtained, known drug allergies, serious illnesses, current medications, previous hospitalizations and surgeries, review of physiological systems, and the ASA risk standard. Daily treatment entries should include a review of medical history with changes noted, the number of radiographs taken and a diagnosis, the treatment plan with options, a written informed consent, and any medications provided. Entry errors are lined through and initialed. No erasures or white out on a chart recorded. Maintenance of dental records should be an area of strictest compliance with all practitioners. On the Texas State Board of Dental Examiners homepage, under the Enforcement tab, there are currently 26 legal frequently asked questions listed. Of these 6 questions, they are related to dental records. This information is found in Rules 108.8 and is worth reading in its entirety. Maintenance of dental records, created, maintained, and owned solely by the dentist. Keep for a minimum of 5 years, destroyed in a way that maintains confidentiality. Notify the Texas State Board of Dental Examiners within 5 days when transferring to another dentist who takes over the practice. Copies must be made available to the patient. Can charge for the cost of copying. Copy for another dentist is permitted. The original dentist must still keep a copy. Cannot withhold due to unpaid balance. Specific information on the requirements for HIPAA can be found on the website listed on this page. There are also links for helpful websites on the board's homepage. A release of information must include the specific information being released, the person to whom the information is shared, the purpose of sharing, the patient's signature. A person practicing dentistry in the state of Texas shall, upon demand by the officers, agents, or employees of the State Board of Dental Examiners, acting in pursuant to a sanitation complaint, grant immediate access to the entire dental office premises to those persons making such demand. Failure to grant such access may subject a practitioner to a temporary license suspension. Any instrument used inside or outside the mouth may penetrate the soft or hard tissue must be sterilized. And any instrument that comes in contact with hard or soft tissue may be disinfected as long as the solution is tuberculocidal. The label on the original container will indicate the level of disinfection that is possible. Oral prosthetic appliances and devices from the dental laboratory must be washed with a detergent and water solution, rinsed, disinfectant, and rinsed again before the appliance or device is placed into the patient's mouth. Additional permits are required for dentists who use levels of pain control from analgesia to deep sedation. There are several pages of requirements for dentists that can be found in the Rules Chapter 108. Congratulations, this is your last slide. This is a summary of the functions of the Texas State Board of Dental Examiners. You may now complete the module reflection questions at the end of this assignment.